Hello guys, my name is Mama Azizat Minjosbi, metric number 77003. I am from Group 5 and our proposed topic is sex education. So sex education basically means it is to help people gain information, skills and motivation to make healthy decisions about sex and sexuality. It is also a way to raise awareness about unhealthy sex behaviors. In our next presentation, we will explain about menses and hymens. After that, we will talk about protection during intercourse for HIV and AIDS prevention. Next, we will talk about sex education for kids. This is for which part of their bodies that other people shouldn't touch. And last but not least, we will talk about family planning. Alright, that's all from me. Thank you.
Hello, my name is Christy Andrea and my matrix number is 77503. Today I'm gonna explain to you a little bit about what is hymen and what is menses. Hymens is a thin piece of mucosal tissue that partially cover the external of vaginal openings. Many people always associate hymens with a sign of them losing their virginity. Well, the truth is not, because here's the why. First, not many people that have vagina was born with hymens, and that is normal. And two, you can see or feel your hymen. And three, your hymens get thins over time to time. So that's why when you're doing physical activities such as climbing, horse riding, cycling, or even dancing and gymnastic, or even when you're doing gymnastic, it can tears down your hymens. And fourth, not all vaginal penetration is about sex, but by inserting a tampons or menstrual cup or getting your pap smear done or getting transvaginal ultrasound is also called vaginal penetrations. And fifth, it is possible that you won't bleed when your hymen is tears. And last but not least, there is no accurate medical way to test whether you are virgin or not. And last, menses. Menses is also known as menstrual cycle. It is a monthly regular discharge of blood and mucosal tissue from the inner lining of the uterus through the vagina. Every month, female body will prepare for pregnancy. If no pregnancy occurs, the uterus or womb sheds its lining. Usually, this menses is begin when the woman or female is at the age of puberty, such as around 12 or 15, and it can be stopped or ended until the menopause age, for example, around 50 or 40. So that's it. Thank you for listening.
Hello and good day everyone. My name is Basil Baginda and today I'm going to talk about HIV and AIDS. HIV is the acronym for Human Immunodeficiency Virus and AIDS stands for Acquired Immunodeficiency Syndrome. This is how HIV works. HIV is a virus and it attacks the body and depletes itself of any type of immune systems, which can be a barrier and fighting for infections and disease. It takes up to 6 to 7 months for it to be detected. As it progresses, the body is prone to any type of infection or disease because it's unable to fight back. This condition is called AIDS, when the body is under a condition where it's unable to fight back any type of, even the simplest of disease or illness, such as fever or flu. There are two ways of how this can be transmitted from another person to another. The first one is through blood, which can be either blood donation, which is not really a thing now because they can find out if your blood is tainted with HIV or not. Or through dirty needles, either by amongst drug addicts or by unclean needles in the hospital. The second one is a little more taboo in topic, which is through sexually. So it could be transmitted by semen or vaginal fluid and can be transmitted through 3 ways that I know of, which is oral sex, anal sex or vaginal sex. One of the best ways to prevent the transmission of HIV is by taking PrEP. PrEP is the short form for pre-exposure prophylaxis. This is a type of drug of medicine which is used to keep the HIV virus dormant. So when a person with HIV wants to have sex to produce children, the children will not get the HIV virus. This is because the HIV virus in the host is dormant, hence they cannot spread and multiply to its child. This PrEP also can be taken by individuals that have not had the HIV virus. So if you take it, you most probably will not get an HIV virus from another person. This is especially important when the person with HIV or not HIV taking PrEP can have multiple sex partners without being fear of infecting others or infecting themselves with HIV. Another method, which is the simplest of methods that doesn't require any type of medicine, is men, wear your condoms, because condoms can help a lot in terms of not transmitting the HIV to another partner. For example, if the male has HIV, if he wears a condom, the female will not get HIV. Or if it's the opposite, for example, because HIV can be transmitted by vaginal fluid, so doesn't mean it's only semen. So for example, if the woman had HIV, the man who is wearing the condom will not get HIV from the vaginal fluid because there's no direct contact of the fluids happening going inside the body.
Hello guys, my name is Aiman. I am from Group 5 and I want to talk a bit about sexual education, specifically on sexual education for kids. As you all know, sexual education was not received very well in this country for various reasons, but mainly because of religion, because people always thought that sex ed is all about the sexual intercourse and how to prevent women from getting pregnant, when actually it is more than that. Sex ed also comprises on how to identify sexual harassment and how to protect the body. Okay, back to the main point. At the age of 2, kids should know that their body is their own and no one can touch it without their permission. They should know that other people can touch them in some ways but not other ways, and that no one should be asking to touch their genitals except for their parents or healthcare providers. If they know what is appropriate and what is not, they will be more likely to tell you if they experience sexual abuse.
Hi everyone, my name is Milena Marni from Group 5 with my matrix number 77581. So for our campaign, I'll be talking about family planning. So there is no proper sex education here in Malaysia, so sex education is important even to married couple. When it comes to a happy family, family planning plays a big part of it. So family planning basically means deciding when it is the right time to have children. So what is the right time to have children is when a woman is aged between 20 and 35 years old, their last childbirth at least 2 years ago, or if the medical problems are well controlled. Also, the last one is when both couples want to have a child. So there are many methods of contraceptions available, which are IUCD, implants, injections, vasectomy, and also condoms. Thank you.